computer.
Okay, so hello, I'm Dr. Nola Veazie. I am the CEO of V Solutions Consulting. V Solution Consulting is proud to announce our test preparation training. We are committed to helping addiction counselors pass their certification exam. Here are some reasons we believe people struggle to pass their exam. Number one, lack of proper preparation. Number two, studying in a way that is incongruent with their learning style. Number three, test anxiety. V Solutions will help you create a strategy for studying effectively. We will help you use your learning style to create a specific study technique that fits your style. We will also understand that some people feel anxious when placed in front of a test and are expected to complete it in a specific amount of time. V Solutions will teach you relaxation and other psychological techniques to turn down the alarm bells triggered by the fight, flight, or freeze mechanism that is controlled by the amygdala, a structure in the brain where emotional dysregulation happens. I have with us Mr. Thurman Brown, one of our trainers who will help you understand and employ the 12 core functions and 46 global criteria. Mr. Brown, tell us a little bit about that.
Hello, everyone. Thank you guys for joining us. The 12 core functions of counseling and counseling competencies are probably the best guideposts a beginning counselor could have in their journey in the field of counseling. So it's important to note that you guys will be getting a comprehensive look at all of the 8 domains that support the 12 core functions. So let me just run through them. Screening over the telephone. Screening is the initial process of gathering information to identify potential substances, substance use, or other related conditions. So you want your screener to be someone who can really ask a lot of questions about substances, because we need to gather all of the information that we possibly can to enable the next process to be really effective for this particular person. So the next process in the 12 core function is intake. Once a person is screened over the phone, we give them a schedule and say, hey, listen, could you come in and physically, now that COVID has, relaxed and folks can be physically there with social distance and procedures in place. But we would invite the person to come in for an intake. An intake is a process, and I would like you guys to always remember each function is a process. Intake is a process for formal admission process where relevant information is being collected. Yes, a lot of information is being collected, including personal history, demographics, and consent forms to establish the basis for treatment. Because all of this is important. Consent forms, you want to be able to have these various conversations with folks who may have been the referral source, Department of Corrections. There's just so many things, doctors, psychiatrists. So you want to be able to take them through that intake process and put these procedures in place. The next process in the core functions is orientation. Once a person has traveled through screening and intake, they will be embraced with the orientation process. The orientation process is the process that introduces the client to the agency, the program policies and procedures, the treatment goals, as well as answer many questions that the client may have because, hey, you're just walking into a new treatment situation. How is this going to look for me? So orientation is that process where you can begin to start the client-counselor alliance, and you guys can you can begin to start helping them walk through that process. The fourth function in the 12 core functions is assessment. This is when you put your clinical skills together based on the screening, the intake, and the orientation of that client. You're going to look at the overall arch of this information, and you're going to begin to complete a systematic evaluation of the individual's biopsychosocial and behavioral factors to determine the presence, severity, and impact of the substance use disorder or the substance of choice, or whether or not they have a co-occurring disorder. So the assessment is looking at the information that you have and really figuring out what direction should we take the client in. So assessment is very important because you may be passing this client's folder off to another clinician who's going to rely on you to really have your critical thinking skills and assessment skills on point, because this is going to give them a head start. So that's the way I would like to start beginning to look at these processes, because they are helpful. Number 5 in the 12 core function is treatment planning. Treatment planning is collaborative. In other words, you work with the clients. You don't create your own treatment plan for the client, even though you may say, hey, listen, I think that this client could go through these stages of changes and they'll be all right. No, treatment planning is collaborative. You really speak with the client and you guys begin to develop a comprehensive and individualized to the client, an individualized plan that outlines specific goals that's realistic for the client. Not your goals, but the client's goals.
Absolutely.
Interventions and strategies that will identify and address the needs and really promote recovery for this particular person. So treatment planning is meticulous and is individualized to this person. Counseling is the next core function. Counseling is utilizing evidence-based practices, techniques, and approaches to facilitate client change. I just mentioned stages of change, preoccupation, pre-contemplation, contemplation, and all of these various things, change talk. You want to be able to begin to start using evidence-based practices to help you really help the client
elicit change talk, right?
Exactly. We want to elicit that, and we want to be able to measure how that is coming from the client. So, we really want to use counseling skills to address other underlying issues and support the development of a healthy lifestyle for this particular client. So counseling is number 6 on the core functions of the competency. Case management. A lot of folks stumble on this, but case management, to me, is the bread and butter. Case management is really about coordinating and advocating for the client various services that they may need. So it's not just about me using my incredible counseling skills to make this person better, but looking at my overall interaction with this person and saying, you know what, maybe outside referrals, outside resources can really take this person where I may be stuck at. In my counseling, I want to use my support system. And case management is about putting together a support system that's going to help you help the client. So you need an arsenal of tools of things when you're dealing with, substance use disorder. So you need some help. Don't think that you can do it by yourself.
I like that you said that, Thurman. That is key.
Okay, thank you. Crisis intervention is number 8 of the 12 core functions. A crisis intervention is providing immediate and targeted interventions to individuals experiencing acute emotional distress, high-risk situations, or relapse in order to assure safety and stabilize their well-being. So crisis intervention is essential And people who are using substances have a crises all the time. Some crises are mild, but to them it's severe. And some crises are severe, and they may try to minimize it as if it's mild. But as a counselor, you come in and you should be able to recognize that there needs to be some type of communication taking place in order to address, what may be standing in the way of the client's best health. So number 9, client education is specific in the 12 core function, offering information, resources, and skill training helps the clients to increase their confidence, help them to really feel better about, what sobriety looks like, because some clients will say to themselves, I know what it feels like to get high. So there's a benefit in it. But I have been a long time without being sober or productive member of society. So what is the benefit of me becoming sober? And the education, the job training, and the referrals to these type of resources could be instrumental in you helping to build their confidence in this area. Because people have muscle memory. They remember what they had done before. But if it's been a long time, you need to really help them. So number 10 is referrals. Number 10 of the 12 core functions is making the appropriate and timely recommendation for additional services. So referrals are important. If a client comes to you and say, listen, my stomach is hurting, you don't say to the client, well, I'll circle back on this conversation the next time I see you. No, we need to contact their primary care provider, or if they don't have one, well, let's see whether or not we have Medicaid or some type of insurance that would enable you to do a walk-in, go to, one of these care places, but we're going to send you to the hospital. And if you cannot get there by yourself, we're going to have someone escort you there. So all of this is a part of the referral process. So when you're looking at your job as a counselor and what you can and cannot do, you have a lot of discretion. It's called case management. Okay, number 11 is of the 12 core function is reporting and record keeping. They are essential. I cannot emphasize more how important record keeping is.
Absolutely.
You have to maintain accurate and confidential documentation of clients' assessments, progress notes, treatment plannings, the interventions, and other information in compliance with legal and ethical standards. So you just can't be freestyling, just writing stuff up in these progress notes trying to get to the next week. You have to really have a methodical way about looking at content, about looking at assessment, and having a plan moving forward. But all of this has to be documented. Sorry.
It has to.
Yeah, so number 12 and the last function of the core functions is consultation with other professionals. Collaborating and seeking guidance from other healthcare professional specialists or interdisciplinary teams to ensure comprehensive care, address complex cases, and facilitate integrated treatment approaches is essential. It's another one of your tools.
Essential.
So those are the 12 core functions. We're going to really take a comprehensive look at them, and we're going to have some case studies that really see what all of this means, because I know that, it can seem like hieroglyphics, but once you really start to look at it and just really, piece it apart, you guys know how to do this work and can
Absolutely
formulate the language.
Amen.
Yes, ma'am.
You know that the heart of V Solution is not only to help counselors pass their examination, but to be competent. We seek for counselors to be competent so that they can take care of their clients in a very competent way. So when we teach, whether it's the 12 core functions and 46 global criteria, whether we're teaching counseling, documentation, or any of the number of trainings that we provide, we have trainers such as you who are competent in those areas, but also are able to break it down in bite-sized pieces so that our counselors, those who are going to take the exam, can comprehend. And no matter how it's presented on the test, they're able to understand and apply their knowledge.
Yes.
So I'm hoping that those of you who see this video are going to go to the CADAP website, click on this video, ask for V Solutions Consulting, because we have trainers like Thurman and others that are going to break things down for you. We look forward to seeing you. We look forward to you taking some of our classes, becoming our clients. And Thurman, any last words?
See you guys in the room.
See you later. Take care.